Okay, so this is her form of consent to do the video. Okay, so I would gather my supplies, knock on the door, wash my hands, pull the curtain, put on gloves. Hi, my name is Haley. I'll be your nurse today. Can you verify your name and date of birth?
Valerie Eyring, April 2nd, 1999.
Okay, and then I would check her armband to make sure that I have the correct patient. So we're going to be doing a neurological assessment. So have you had any signs of a migraine or stroke?
No.
Okay, I'm going to ask a few questions. So what's your name?
Valerie Eyring,
Where are we today?
Toledo Hospital,
And then why are we here?
an assessment.
And what's the month and the year?
April 2020.
Okay, so she's alert, awakened, oriented times 4 based on those questions. And then how are you feeling today?
Good.
Okay, so she looks clean. She's dressed appropriate for the weather. She is she's making eye contact with me. She was smiling, and so her behaviors match her stated mood. And then I'm going to ask you a couple more questions. So what's the difference between a triangle and a square?
A triangle has 3 sides and a square has 4.
And then if you're driving and approaching a red light, what would you do?
Stop.
Okay, so her speech is clear, articulate, and I can understand her well. So I would be assessing glaucoma scale now. So she would get 4 points for rapid eye opening. She would get 5 points for appropriate verbal response. And then can you squeeze both my hands? And then she would get 6 points for appropriate motor response. So this patient has 15 points total. And then we'll be assessing the cranial nerve. So the 5th cranial nerve is the trigeminal nerve. This is sensory and motor. For the sensory portion, I'm gonna have her clench her teeth. And then I'm gonna palpate. So that was strong and equal bilaterally. And then for the next part, I'm gonna have three objects, and one is gonna be soft, this is soft, this is sharp, and then this is dull. And then I'm gonna have you close your eyes and do it on your face. So what was that one?
Tall.
What was this one?
Soft. Dull. Sharp.
Okay, so she guessed all those correctly. Then I would move on to the, and I would test the corneal reflex by whatever, open her eyes and then look upwards and then to the side. I would touch the cotton on her eyeball and then she should blink. And then the next one is the 7th cranial nerve, which is the facial nerve. It's also sensory and motor. For the sensory portion would be like assessing the taste of the sour, sweet, and salty on the anterior 2/3 of the tongue. Then the motor part would be the facial expression. So can you smile, frown, puff out your cheeks, and then raise your eyebrows? So all the movements were symmetrical and there was no signs of facial drooping. The 8th cranial nerve is the acoustic nerve, and this is just sensory. So I would perform the Weber test first. If I had a tuning fork, I would strike it, place it in the center of her head, above her head, and then I would tell her to tell me if she hears it in the right, left, or both ears. If there was conductive hearing loss, she would hear it louder in the poor ear, and if there was sensory neural loss, she would hear it louder in the good ear. And then the Rene test is next. This is to compare bone conduction to air conduction. So I would strike the tuning fork again, place it behind the ear on the mastoid process, and then bring it forward. I would have her raise her hand when the sound stops, and then I would do it again and bring it from the side forward, have her raise her hand again to tell me when the sound stops. I would be like measuring the time in between these to test the length of the bone conduction and air conduction, because air conduction should be twice as long as the bone conduction. If there was conductive hearing loss, the bone conduction would be greater than or equal to the air conduction, and if there was sensory neural loss, the air conduction would be greater than the bone conduction if it was heard at all. Next, I'm going to be performing the whisper test. So I'm going to stand behind her. I'm going to whisper a word to you and have you cover one ear and just tell me what you hear.
Nursing.
Okay, switch.
School.
Okay, so she guessed both of those correctly. Next, I'm going to check the upper extremities for deformity. So can I palpate your arms? Okay, can I?
Mm-hmm.
Okay, so I have to palpate the shoulders, move to the elbows, the wrists, down to the fingers. So there was no abdominal warmness, there was no visible redness, no swelling. Did you have any pain?
No.
Okay, and then I don't see any deformities. Next, I'm gonna move on to the testing the strength and the range of motion of the shoulders. Oh, and I forgot, can you squeeze my hands also? Okay, so the strength is strong and equal bilaterally. So not of the range of motion of the shoulders. So if you can push upward on my hands, then push downwards. So that was strong and equal bilaterally as well. And can you put your arms up like this and then behind your back? So she has good range of motion, and then circle your arms. So she has full range of motion. Next, I'm going to be moving on to testing the lower extremities. So I'm going to palpate the knee first, down to the ankle and the toes. There's no redness. And then, did you have any pain?
No.
Can you circle your ankle around too? Any pain?
No.
Okay, so there's no redness, swelling, abnormal warmth, and no pain, no deformities either. And then, do you have numbness or tingling in your legs?
No.
Okay, if she did, I would see how far it went up the leg, and then I would assess further and notify the physician. Then I'm going to be checking for plantar reflex. So by doing this, I would have her sit back on the table with her arm or with her leg out and relax. I'd tell her to stay still. I would take the reflex hammer and move it from the bottom to the top of the foot. Her toes should curl downwards, and then this would be a sign of a negative Babinski test. Then for plantar flexion and dorsiflexion, so if you could just push up on my hands and then push down. So the upward was the plantar flexion, and then pointing downward was the dorsiflexion. Both movements were strong and equal bilaterally as well. Then I'm going to test for the cerebellum and motor systems. So if you could go like this on your legs and alternate. Okay, and then can you go faster and close your eyes while you're doing it and go faster? Okay, you can stop. So she's well coordinated with that movement. And if you can touch your nose like this with one arm to the side. Okay, and faster. Close your eyes, faster. Okay, you can stop. She's also well coordinated with that movement. And then I'm going to have her stand up, and then so I can watch her gait and her posture. So if you could just walk around the stool. So I'm looking at how she's walking, and her posture is upright and erect. She's not slouched over. She's not swaying from side to side. Her arms are moving in opposition with her legs, and her gait is steady. Okay, you can stop. And then lastly, I'm going to be performing the Romberg test. So I'm going to have you stand with your feet together and arms at your side. And then I'm going to tell you to close your eyes. You can open them if you feel dizzy at all, and just let me know. So if you can close your eyes. So I'm going to be doing this for 20 seconds. She has minimal swaying and she has good posture while doing this, which are both normal findings. So I would do it for a full 20 seconds, but you can open your eyes. And then, so I would put the bed in the lowest position, her items in reach, the colla in reach, both the side rails up, and I'll position her for comfort and then document my findings.